Welcome back to Inside City Hall. Today officially marks 100 days since President Donald Trump took office, and in that time, he has drastically attempted to reshape the federal government through mass layoffs and spending cuts. One such change has had far-reaching implications for our city's health department. The Trump administration last month stripped our department of $100 million in infectious disease prevention funds. Now local health officials, including my next guest, are warning that this will greatly impact New York's ability to protect us all against future illnesses. That includes vaccine-preventable diseases like measles and hepatitis A. All of this comes as measles cases have been on the rise nationwide, and Health Secretary Robert F. Kennedy Jr. has been inconsistent, to say the least, in his support for the MMR vaccine. Joining me now to talk about that and much more is Dr. Michelle Morse, the Interim Health Commissioner and Chief Medical Officer at New York City's Department of Health and Mental Hygiene. Welcome to the program. Great to see you.
Thank you so much for having me.
Let's talk about this $100 million for infectious diseases. What was the money being used for, and how will this possibly affect the health of city residents?
Thank you so much for asking. It is a time where local public health is unfortunately in crisis in many ways. These funds that are essential to our core public health services in New York City included things like us being able to staff our public health lab. That's the lab, for example, that can give us a measles test result in a couple of hours, so we know how to act upon it. It also included a lot of our disease surveillance infrastructure. Data is our superpower at the health department, and we need modern data systems to be able to manage the huge volume of testing, predicting where infectious outbreaks might be and go next, et cetera. And it also included funding for things like our vaccination programs, including community engagement and educating the public about the safety and efficacy of respiratory viral vaccines, COVID and flu. So these are truly core public health programs and functions.
As far as you know, are these cuts targeted to New York, or is this part of a general reduction happening nationwide?
Unfortunately, this is a nationwide problem. There's about $11 billion in funding from the CDC that was suddenly canceled. We, in fact, found out about the termination on March 24th, and it was backdated to the 23rd. So these are the kinds of things that local health departments all across the country are having to deal with. Most of them actually are very dependent on federal funds. For us in the New York City Health Department, about $600 million in our annual budget is from federal funding. It's about 20% of our budget. Colleagues in other big cities, Chicago, Dallas, 80 to 90% of their funding is federal funding. Wow. So this is impacting local health departments in a way that is incredibly challenging right now.
Are your counterparts in some of those big cities dealing with the same kind of questions about the infectious disease infrastructure kind of just going away all of a sudden?
Absolutely. Every single commissioner of a local health department that I've talked to is really struggling with both the sudden nature of this rescission, the fact that this was a commitment, a relationship, an agreement between the federal government and local health departments and their people to protect their health, and it was suddenly rescinded. And many of them are trying to problem solve for other ways to fill the potential gaps. But one of the most challenging parts about all of this, of course, is we don't know what's next. Right. So even for us in the New York City Health Department, planning around this $100 million is one thing. Planning around the full portfolio of $600 million in federal funding is much more challenging. And we in New York City are the portal to the country and the world.
Well, I was going to say, you may not know specifically what's next, but you know that there will be a next, right? Whenever I read about measles outbreaks, hepatitis outbreaks, Ebola outbreaks, even overseas, literally sooner or later, that's going to find its way here, right?
This is the gift and the curse, I suppose, of New York City. We are often hit first and hardest when it comes to infectious disease outbreaks. That was true in COVID, that was true in Mpox, that was true in Ebola. We are the portal to the rest of the world. We're the most global city in the whole country. We're also, the largest city in the whole country.
The densest, probably.
And the densest. Yeah. And luckily, we have the largest local health department in the country, which is proportionate and what you would expect. Right. However, we have more risk in New York City than other places do, frankly, because of the nature and the beauty of the international, kind of nature of our city.
Well, the city budget is going to be finalized in the next couple of months. Is this, I imagine, high on the agenda? If it's not, it probably should be for both the council and the mayor.
There are a lot of conversations happening right now between our agency and City Hall and every other sister agency across the city as well about the fact that we're not the only agency, of course, that has federal funding. So this is a big challenge. It is a huge priority for us. And I'll say specifically, we're working on priorities around tuberculosis. We're working also on priorities around our Healthy NYC campaign. All of those things rely on the core infrastructure that's funded by this $100 million in CDC funding.
I know you're working and have worked in the Adams administration, but whether the next mayor is Eric Adams or anybody else, what are the priorities that we should expect the next mayor to focus on, or expect the mayor to focus on come January 1st?
The things that keep me up at night are a lot of these infectious disease threats. We have learned so much from the COVID pandemic in the New York City Health Department. We know how to prepare ourselves for the next epidemic. And so we need to continue to invest in public health. It can't just be turned on and turned off if and when there's an emergency.
Sure.
We have to do ongoing planning to make sure our systems for emergency response are strong and ready to go literally at the drop of a hat. Another priority that I think is incredibly important is chronic disease. We have a huge burden of chronic disease, unfortunately, in New York City. In fact, it's the #1 killer of New Yorkers, cardiovascular and diabetes.
Sure.
And our Healthy NYC campaign, our vision is that we extend life expectancy in New York City to 83 years by 2030, with the vision that that's actually the longest life expectancy the city has ever had.
Where are we now?
We are on our way. I can tell you with confidence, and actually this is a victory, we are on our way to meet or exceed our goal of 83 years. We'll be releasing more data in just a few months actually on that. And at the same time, we cannot sleep on chronic disease. It's the #1 killer again, and there are a ton of interventions that we know work that will help to prevent completely preventable illnesses and diseases for New Yorkers.
I want to ask you about that. Tomorrow, I know some officials and activists up in the Bronx are holding a diabetes action summit. They're calling on the city to declare a diabetes health emergency. Does that sound like a good idea, or is that something you might do?
Well, here's what I'll say. Diabetes is a problem. And there are a number of ways that the health department has been working with both community-based partners and communities all across the city, as well as our healthcare delivery partners, to address the issue of diabetes. The Bronx has double the rate of diabetes of every other borough. And for over a decade, unfortunately, the Bronx has had the worst health rating of all 62 counties in New York State. So do I think it's important to focus on the Bronx? Absolutely. And I think there are a number of ways we can do that, whether it's an emergency or not, debatable, but it's certainly a top priority for me. I'm an internal medicine doctor. I take care of patients at Kings County Hospital. Diabetes is on the list of just about every patient I see. So this is something that I believe we can do even more work on.
I know this mayor and your department are, and as well as health and hospitals, are focused on lifestyle medicine, diet, exercise, peer education, and so forth. But so many of the efforts, and I'm thinking in particular about the diabetes self-management program, they talk about educating 2,000 people at a time, or 20 community organizations. Don't we need to scale it up to the level of public education campaign that we saw during COVID? I mean, you're talking about like close to 1 million New Yorkers who are either diabetic or pre-diabetic, right?
This is a huge priority. And what I would say is no one thing is going to get us the final solutions we want around diabetes. It is a combination of things. And what's really important is it's not just managing diabetes once people already have it. How do we prevent the next 10,000, 50,000 cases of diabetes in the city?
You can reverse it too. I mean, we learned that from the mayor.
There are a number of ways to manage and kind of, advance the care of people with diabetes to make sure that they don't have any complications. But what I would also say is we don't want to focus only on taking care of people after they're sick. We're working on a lot of upstream ways that we can prevent diabetes from happening in the first place. And that's part of our role in the health department, is to say, actually, there are policies and an ecosystem that we can shape to make sure that 10 years from now, we're not saying the Bronx has the highest rate of diabetes in the whole city.
Please consider us part of that ecosystem. You're welcome anytime to talk about that and other chronic diseases. Thanks for coming by. Great to see you.
Thanks for having me.
Okay, we're going to take a short break now, and when we come back, funding for healthcare is not the only thing that President Trump has threatened. He also has his eye on a bill promoting the growth of the semiconductor industry here in New York. We'll explain that in 2 minutes. Stay with us.